Hi everybody, this is Alec again with Home and Rehab, and today I want to talk about the differences between when we're exercising for pain versus when we're exercising to work for fitness in general. Now, fitness dosing is kind of how we describe how many and how often we're doing things, is relatively well researched and well based in a very, very simple set of principles. That is, we are trying to dose either for power, strength, or endurance. People who are trying to do powerful movements, we're trying to get them to lift very, very heavy objects very, very quickly, but they don't need to do it very often. So usually about 6 repetitions in a set for just a few sets at a time to make sure we're not overloading these muscles with this excessive load. If we're just trying to build raw strength, which means we're just moving that heavy object slowly as opposed to very, very quickly, that strength can be done at a slower pace, which means we can get more repetitions in. You'll usually often see a set for strength training be somewhere between 8 and 12 repetitions, meaning that we're just trying to get this out enough that we're delivering enough challenge. We'll do a couple sets of that, and then we try to give ourselves some time to recover. Endurance is the ability to do things over and over and over and over again, so of course we're trying to do longer sets. Usually sets in this range are somewhere between 15 and 25 repetitions, and we're often doing higher numbers of these sets. These are some very basic utility principles that help us dose depending on our goals, and sometimes depending on the muscle groups we're working on. So, for someone who is a long-distance runner, we have found long-distance runners benefit as injury prevention from doing some sort of training that helps with the strength in their legs. But because they're going for endurance, we want to have this at the higher dose range, which means we're looking 15 to 25, a couple sets of this, and making sure that they're still fatigued at the end of those sets. On the other hand, if I have an athlete who has a lot of power involved in their sport, one of the most common examples we use is a linebacker, somebody who has to immediately go from one position to another and just push as hard as they can. They're trying to do power lifts, meaning they should be exploding through their movement, but because their plays are relatively short for their own safety and for the style of game, we should also make sure that we mimic that when we're trying to train them. Pain is very, very, very different because pain dosing is not necessarily trying to rebuild tissue like we thought we were for a long time. Very often we find, as we've talked about in the past, that pain and tissue damage are not necessarily correlated as well as we thought. And we can have low pain with high tissue damage or high pain with low tissue damage. What we want to do is respect the nervous system as we have pain. So we use 2 different scales. We use our visual analog scale, which is what we call that scale of 0 to 10 when we ask you to rate your pain. 0 pain being none and 10 being, oh God, just cut the arm off. On the other hand, we also have our visual analog scale that we use for effort. 0 being lying down doing nothing, 10 being really, really working hard, running as fast as you can, push, 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 push. If I'm trying to dose for working out my pain, I want to make sure that I'm operating with both of those scales in mind. My effort level, which normally we would dose based off of our goals for our eventual function, for when we're working around pain, we want to keep our effort level and our pain matched. So, if we combine the 2 together, it shouldn't be more than a 10. My pain's a 3, my effort can be a 7. But if my pain during exercise is a 7, my effort should only be a 3. That 2 combination can help us get there. Now, we can also go a little bit lower. If I have pain at only a 2, it doesn't mean I have to work at an 8. I can only work safely up to an 8. That is absolutely okay to work a little bit differently within that scale. But it's important to recognize that when we're exercising, just because we are good at exercising doesn't mean we want to work it the same way as we do when we're working for fitness. I, for example, happen to do a whole lot of exercise for fitness. I happen to enjoy it a whole lot, and I do a lot of different styles. However, when I'm rehabbing one of my own injuries, something I pay attention to very, very carefully is how I hurt when I hurt. When I had an adductor strain last year, one of the things I did was I went back down into the levels of exercise because high-level exercise was causing a ton of pain. Even moderate exercise caused a lot of pain, so what I did was I brought it down to low-level exercise, very low effort. And that allowed me to grade my pain back into the things that I'm used to doing. It took a little while, but by respecting that pain, it allowed my body to recover a little bit better. Interestingly enough, we found that had I just rested that, it actually probably would have taken me longer to get better. So just because you're in pain doesn't mean you have to eliminate all activities. It just means we have to modulate how we're doing them. And it is important to continue to exercise. We just need to make sure that we're doing it slightly differently than we normally would. And so as we're doing this, we're using that combined pain scale set instead of our classic dosing mechanisms. Eventually you'll find that the pain is gone, but you might not see your strength back to the level it was. And that's when we're going to go back to our classic style of dosing. All right, I need to build that base strength up. We're in the 8 to 12 repetition range again. All right, but eventually I need this muscle to go, 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 go. This is a long distance muscle. Perfect. Now that I have my base strength back, I can start training into my endurance mode. This basic principle in this framework of exercise, we call it the difference between the art and the science of physical therapy. There is a definitive science that explains to me if a person can push out this 1 RM, which means they can do for one single repetition of an exercise their maximum weight. So for someone on a bench press, maybe 215 pounds, they can lift it once but no more. All right, well, if I take a certain percentage of that, I want them to do this many reps of it. And we have a very well-established curve that tells us in an ideal world how well that would work. But because pain changes how our muscles fire, we have to go into more the art side. All right, based on how you're feeling in both your effort and your pain, how much of this can we get through successfully? It might be far less repetitions, maybe only 2 or 3. It might be way more than our normal. We might be pushing upwards of 40. But what we're trying to do is we're trying to modulate based off of what you feel. How much can you do, and can we grow that? If you guys have more questions about what we do in this clinic or how we do it, please let us know. Drop us a comment or drop us a message so we know what you guys want to know about. We'll talk to you soon.